Hi, it's Mark from Remarkable Speaking. I'm here with Will Cito. He's the owner, the chief cook and bottle washer at Insync Physio in Vancouver and in North Burnaby. And today we're going to talk about running injuries, IT band knee pain. What's this all about, Will?
Yeah, so the weather's getting really nice here, and we're starting to see people running outside, and I'm seeing a lot of more running injuries coming into clinics. A lot of our physios are seeing a lot of runners coming in. So basically what it is the IT band is the strong connective tissue that basically connects a lot of the muscles on the outside of the thigh. It starts actually in the hip all the way down to the outside of the knee. And what it does, it actually adds extra stability to your knee. Now, the problem with running, and especially as you start off like your running season, a lot of people are training for things like the Sun Run that's just happening, that's just coming up here this coming weekend. And just as the running season's starting to peak here, they start to overload. And so what IT band injuries are usually a more of a repetitive type of injury.
So that's just overuse, training too hard too soon, basically?
That's part of it. Yeah, that's a huge part of it. I mean, it's certainly one of the biggest factors. There's a few other things that also can contribute to it as well. But like as you put on the mileage, and if you don't get enough rest and let your body recover, that certainly can lead to the overstretching of the IT band, because then the muscles that attach onto them can really pull them and cause a lot of abnormal movement patterns kind of around the knee. And so then you end up getting this knee pain on the outside of your knee, which can also lead to like a clicking sound that can happen there as well. Well, you basically would do a bunch of different tests. You would on, obviously, like I said, the IT band is part of the knee that provides stability to the knee. And what you want to do is you want to rule out all the other ligaments and see, how that is. Now, if you've had a pre-existing injury, then you could have these imbalances happening in your knee too. So the IT band syndrome, there's specific tests for it to look at different muscle tightnesses and how that could be pulling on it abnormally. And so essentially, if those tests are positive and you're looking at the pattern of how things are moving in the knee, then you can determine that it is IT band syndrome. And a lot of the times you have like a few factors involved. Like I said, that's an overuse thing, but then you may have sort of inclination with like your body type. If your feet are a little bit more flatter, which is called pronation. And if you're running in shoes that are worn out, and that can basically provide less support for the running and mechanics of it. And then the other thing is also, the really important aspect of this is looking at like, are you running on a lot of flat versus like cambered surfaces? Are you doing a lot of trail running and then it's causing your knee to really buckle? And if you're doing a lot of like hill training, then you're getting your hip flexors really tight. And so then what happens is that those muscles end up being really pulled, and it causes pulling of the IT band, which can give you the pain that you can experience in the knee. So I think the other aspect to looking at IT band injuries and knee injuries with running is, how do you treat it? So one of the big things for treatment is really looking at rebalancing everything around the knee. And so part of that rebalancing is doing things that are basically going to take the load off of it in terms of mechanics. First thing you want to do though is definitely unload what's causing it to give it pain. And so if it hurts with running, then you want to basically take down your training a little bit more and let it settle down, because when it's really bad, you can actually have quite a lot of swelling and then you can't even walk. So you want to look at the training load and really decreasing that. And obviously we talked about footwear, and then looking at recovery. Are you recovering enough? And then are you getting too much training at a high intensity and then not letting your body recover? And so the other aspect too is we talked a little bit about, if you had a pre-existing injury, then you can start to compensate with like your hip flexors and some other muscles. So then you might want to start to look at, okay, so do I have other deficits, or do I have other issues that I want to address? Like, so maybe I have a weak core and I'm compensating with my hip flexors to basically stride and really push through. And that's the other issue. Is my stride, am I always overstriding? So then maybe I want to look at that in terms of my running mechanics. So we would actually do a running mechanics. We have a treadmill that we can actually look at a bunch of different factors involved in terms of your posture and how you run. And also, part of that posture is like making sure that your cadence. So your cadence is like, how many steps are you taking per minute? And then they've done research studies and they show that if you're under a certain amount of steps per minute, you're actually more prone to knee injuries. And so that's another factor.
If you need help with any kind of running injury, knee or anything related to your running program, see the expert trained sports physios at Insync Physiotherapy. You can book your appointment at insyncphysio.com, or you can call the Vancouver office. They're on Cambie and King Edward. You can reach them at 604-566-9716, or the North Burnaby office. They're on Hastings near Willingdon at 604-298-4878. Insync Physio. Get feeling better, get moving right and running. Enjoy this beautiful summer we've got coming.